So my name is Rani Singh. I am a pediatric neurologist and epilepsy doctor here in the Charlotte area at Atrium Health. I've been here now for about 5.5 years. We love Charlotte. We love North Carolina. And I've been practicing now for more than a decade, almost about 12 years. And so I'm a neurologist or doctors that kind of specialize in nervous system disorders or brain disorders, and I'm just a little bit more specialized in epilepsy, where I focus on trying to treat and improve and cure kids who have epilepsy or a tendency to have recurrent seizures. When I was in medical school, I think I always liked neurology. There's so much that we don't know about the brain. There's so much that we might not ever know. And I thought it was fascinating. And I think I picked epilepsy a little bit more because there's a way that you can sometimes, really help people, kids, especially since I'm a pediatrician, in trying to control seizures, help them live the best lives that they can, as normal of a life as you can. And the treatment for epilepsy continues to grow and advance with a lot of technologies that we have that we didn't have. So I think it's just a fascinating and fulfilling job for me. I hate epilepsy, so I think that's why I'm very passionate about it too. And I've always kind of been geared for being more of a pediatric doctor than an adult doctor. So that's why I decided to kind of stick with pediatric epilepsy. Even with a first visit and a new diagnosis, which I did earlier this week, there are so many questions that come into, a child and a parent's mind. And, we just don't have enough time in the world, to explain, so I try to do my best to explain. And we also know that in the medical field, when you're giving a diagnosis or explaining something, this is the challenging thing, is that because it's such a shock, that only a small percentage of what is told is remembered, or absorbed. So I find that I tend to repeat myself a lot, and try to explain and take as much time as I can, talking about epilepsy. And the big questions that anybody has is, how long after a first seizure, the big question is, what are the chances of having another seizure? And it really depends on each person. Some people can have one seizure in their lifetime and never have another seizure. What we call epilepsy really is defined as having two or more unprovoked seizures, or the tendency to have knowing that you're at risk for having recurrent seizures. And I usually kind of think of that as, okay, it's time to start a medicine to prevent seizures, because we know it can happen again. But the biggest question that we don't always have the answers are, number one, is this going to be temporary? Is this going to be lifelong? And sometimes we can explain, depending on the type of seizure disorder, and give guidance on that. Along that is, will I need medicine for now or forever? For kids, will I be able to drive? And a lot of times the big question is, why? Why me? Why is this happening to me? I don't know anybody who has seizures or epilepsy. I don't know. I don't have any family members, and that can be the case. And a lot of times, sometimes we just don't know why. We know that, I think one thing that definitely made us more aware is that we used to think about 1 in 100 people had epilepsy, and now we know it's much more common, 1 in 26. There are kind of 3 categories of seizures that we'll say, and a lot of it is knowing what kind of seizure it is. So one is called a generalized, meaning it comes from both sides of the brain at the same time. The other category is what we call focal or partial, meaning it comes from one focus or part or area of the outer layer of the brain where the brain waves are misfiring, causing the seizure. And sometimes it can be, and then there's a whole category of the unknown, meaning sometimes we can't tell where seizures are coming from. sometimes it could be something in a focal or a partial seizure disorder. For example, in kids, there are two categories. One is when kids may have something just the way their brain was developed, some subtle change and that causes that area to want to misfire and have the brain waves fire abnormally. And then some can be just out of the blue, that something is what we call age related, means sometimes kids can have these and they may outgrow it. So it really is, there's a whole variety, and it really is the evaluation and the treatment and the counseling about, to answer those questions really depends on each individual person. According to, the medical literature, epilepsy, has even been described back to pre-biblical times. If you go back, it was described as, fits. And so almost like someone was being possessed. And so we're like, okay, great. We've got to, discount that as something that you can, not control, something that can happen out of the blue. I'll tell you, the semantics are tricky, meaning if you say the word seizure, it just doesn't sound as scary as the word epilepsy. And I think that's a kind of big misconception in the public. And so in the community in general, I've had people say, oh, I have seizures. And I try to tell them, well, and if in a particular case, actually it's epilepsy because you're on medicine, you've had more than one. And the term epilepsy is so loaded. There are different seizures and seizures types. So there are kind of milder ones that may be subtle and not apparent outwardly with symptoms. And then there are some that are more apparent and maybe what more people consider as convulsive seizures. The more, a common seizure that kids can get are what called absent seizures. It's spelled like absent, where kids briefly stare, zone out, and then come right back to what they're doing. And those are so brief that sometimes they may go unnoticed. And so someone, an observer may not notice it. And usually the child is kind of safe, but at the same time, if what happens with that type of seizure, if you're not aware, you can put yourself in danger. I think the biggest one that we really get scared about are the convulsive seizures, where someone loses awareness and has jerking. And there are guides on how to make sure someone is safe. And the biggest thing that can make someone unsafe during a seizure is not so much the seizure itself, but the situation they're in. So if you see somebody, you want to turn them, him or her on their side, make sure that on a flat ground. So, if there's head jerking, the person's not going to injure him or herself, call for help. If it's someone that you don't know, call 911, make sure there's nothing kind of in their mouth, and don't put anything in their mouth, and then trying to time it, which is very hard. And one thing that I've been doing working, aside from my day job, is trying to educate and advocate, especially in our community, to help with seizure safety and first aid training in schools, and with nurses and teachers, so people feel comfortable. And so do we need to do a better job of educating and training? Absolutely. Until any person feels comfortable about what a seizure is or how to deal with it, our job will never be complete. Epilepsy comes with its own other challenges. Not being able to drive. When you get older, can you live independently or not? I've got I love my job as a pediatrician because I see from itty bitty babies, to my kids that go off to college, and we have the big transition, from high school to college. I got a scholarship, can I go? And parents, am I comfortable letting my child go? And I have, some patients that it's summertime are transitioning to go to college, and we talked about talking to the roommate, feeling comfortable, having a safety net. How far is the parents want to still be within a stone's throw away of their child, and doesn't want, wants to stay and go to UNC Charlotte and not to, not across the state or out of state and stuff like that. So those are definitely all things that we talk about. We know that anybody who has a chronic diagnosis or illness can have mood problems, and epilepsy is definitely up there. What we call adolescents with epilepsy can have 3 to 4 times higher situations where they also have some form of anxiety or depression, and we have to address it. You can't ignore it. A lot of younger children are not expected to swallow pills. So then you're talking about a liquid that could be twice a day, which thankfully there are medicines that, for older adolescents, adults who can swallow pills are once a day, and they work great. So every time I always, those are the questions I go through, when I meet a patient or with any visit, trying to figure out what's their best, best fit for that person. And we know, thankfully, I guess one thing good about epilepsy is the vast majority of people, 2/3 to 70%, some higher, can be controlled with the right medicine. And sometimes you need more than one, and sometimes you're not going to get it under control on the first try. So there's a lot of pressure on us as your doctor to try to get it right the first time, so you can continue to trust and confide in us to take the best care of you that we can.